He is a case of lymphoma, and he has been treated with 6 cycles of targeted therapy and chemotherapy, and he's fit and fine. He comes on follow-up every 3 to 6 months. He never misses his regular checkup.
First of all, you need to know about your ailment, your illness, and she does a very good job at it. You have to do your own research as well, share with her. She always reaches out. Any text message that I've sent, any emails that I've sent, so has always been responded to.
Hello everyone, I am Dr. Pooja Babbar, cancer specialist. Today I'll be sharing the story of one of our very dear patient from Mauritius. We met 1.5 years back, and he is a case of lymphoma, and he has been treated with 6 cycles of targeted therapy and chemotherapy, and he's fit and fine. He comes on follow-up every 3 to 6 months. He never misses his regular checkup. So with this video, we want to signify the value of follow-up after completing your treatment, which is very important, so that you can understand. Being a doctor, I can understand about my patient well-being, how my patient is doing. Is there any recurrence, or what are the parameters which are not fine in the report? So after treatment of any tumor, there is always a follow-up strategy which should be followed religiously, and it is always good to be in contact with your oncologist. So let us hear from him regarding his entire experience.
Hi, hello everyone. My name is Ghalib. I'm from Mauritius. I'm reaching nearly 49 now, and I was diagnosed some 1.5 years, 2 years ago. And obviously, it was a shock. And after going through to different doctors, different hospitals, diagnosis was there. And lucky enough, I had a friend who gave me the name of Dr. Pooja. We reached out, obviously, but the concern, the treatment was completely different. The first time we reached out to her, the way it was explained to us and the way it was managed, the way it was handled, made a big difference in our choice of her as a doctor, and I don't regret this at all. She's very kind. She's passionate about her work. She's very empathic, and for her, everything is doable and treatable. So we went for the cycle, as she said. All the treatment was done, but most importantly, what I want to stress on is the follow-ups. No matter what kind of cancer you have, first of all, you need to know about your ailment, your illness, and she does a very good job at it. You have to do your own research as well, share with her. She always reaches out. Any text message that I've sent, any emails that I've sent, so has always been responded to. And that's very important, because I, as a patient, I'm concerned. Anything that changes in my blood test, I need an answer for that, and she's always been here. Every time, even though I'm not in the country, I'm in Mauritius, she is in India, and there's a time difference, I understand that, but as soon as she's always sent me a reply to my test that I've done in Mauritius, and that's why I've been coming up and down after treatment, follow-ups. Obviously, it's for any kind of illness, there's something that wouldn't be matching. It's just a journey. And she's always like, tell me, this is what you need to be done, and sending prescription from abroad. And when I'm down here, like for now, whatever came up in our test reports, she's prescribing me, and we're having a plan of treatment, and very important is to follow up. So last, what I want to say is my whole trust is obviously in God, to have helped me find Dr. Pooja, and my trust as medical is in her, and she does a great job. She has a great smile, and she's a great personality, and she's very kind-hearted. So thank you very much, doctor, for all the help and support you've given me and my family through this journey. Thank you, doctor. Thank you, guys.
Your kinds and warm words. So I would like to ask one thing, that since you have experienced it yourself, you are not from here coming, and all that is also tedious, this traveling and all. And to keep up the follow-up is also difficult, because here patients come from nearby only. So any message you would like to give to the patients who are suffering from this ailment and they have difficulty in taking that first step to reach out to their concerned doctor? So what would you like to say to those patients and what is your message?
Right, that's a very good point, doctor, that you brought up. Right, see, I know it is very hard. I mean, in terms of cost, there's a cost implication, but honestly, you'd rather save up and put that money to come here and have the right diagnosis. Nothing is blown out of proportion. That's one thing. Whatever you need, if you need paracetamol like once a day, it's going to be only one paracetamol once a day. If it's only water that you need to drink, it's going to be only water. It's not because you've traveled here that they're going to load you with tests, and that's very important. Trust must be there, and this is what with the doctor I have. I know if I don't need anything, so many times from Mauritius I've sent a text, I'm not sure about this, doctor. Do I need something? Do I need to take something? And there's always been, a very nice message, what you're stressing on. Let me stress about it. That's my job. Don't stress about it. And not being stressed with your disease is one thing as well. It keeps it down. If you stress about your disease, it's going to flare up things and, it goes hayway. Put your trust in God, first of all. That's very important. Put your trust in God, and then put your medical trust in your doctor. And once you have that balance, everything, smooths out. No matter how bad it is, it's going to smooth out. And my medical trust is in my doctor.
Yeah, so it is very important to take that first step. And once you take that first step with complete trust, your things actually fall into place gradually. Like, step by step, your path open up, and definitely there's a treatment available. There are a lot of options. And if any patient is suffering from this disease, should always ask for the help and should take that first step. Thank you.